Thank you for tuning in to another episode on the Scouse Oracle channel. I truly appreciate you being here. If you can hit that subscribe button, it massively helps. Today, I do want to be providing more clarity and talking more about what's really happening with the Children's School Bill and the NHS data. You see, right now, the government is planning to turn the NHS number into a lifelong tracking ID. And if you've been following me for a while, you'll see I am currently waiting for a petition, which has not yet been published in regards to the Federated Data Platform. And I'm going to be going more in depth in regards to the debate that took place with the MPs in Parliament on the 1st of December in regards to the Children's Wellbeing and Schools Bill. Now, what's happening is they're planning on following a child's education and welfare and home life more, and they're starting with home educated children. So as I say, this was debated on the 1st of December and it's happening right now. According to Parliament, Part 1 of the bill creates two major powers: a register of children not in school, including home educated children, and a single unique identifier used across services. Now, the government is claiming that this will improve child safety, ensure no child is invisible, join up services to better protect children. And this all sounds sensible until you're seeing how it really works. So what the Act will do, the bill will give the government right to use the NHS number as a universal tracking ID for all children. And this has been publicly confirmed. So that means one number follows a child everywhere. Health records, school records, social care history, welfare benefits, and any future systems added later. The bill also gives a legal duty for agencies to share child data whenever they want for welfare and safeguarding, not just when there's a serious risk. So instead of we'll share the data when it's needed, it's becoming we'll collect and we'll share data on every child, just in case. You see, once this system's built, it doesn't turn off. So it becomes the new normal. And where home educated families have become the target, the government can use it and say, well, home educated children could be invisible. But you see, local authorities still have the home educated children's list. I myself personally, as you may know if you've been following me for a while, home educate, and I have had a appointment with someone from the local authority. They've been within my house for 2 hours, which was completely fine for me, but they already know that my child exists. And this is part of a pattern, isn't it? We're taking just a group of people and using them. So the bill uses home educating as the first group, forced into a new database, and then later on, every child enters the system. That's the final scope. Now, here's where it's becoming much bigger than just education policy. As you well know, if you've been following me for a while, the US surveillance tech company called Palantir has won the major NHS data contract for the Federated Data Platform. I've spoken about this previously, and I am just awaiting for the petition that I've got running to be published, which it's not yet been published. Now, doctors and privacy experts warn that sensitive personal data is being centralised. Large parts of the contract are blacked out, and it's posing major risks to privacy and transparency. So you have got campaigners, including the Good Law Project, taking legal action to expose the secrecy. And I've provided the link in which you can sign in regards to Good Law Project. So if Palantir are running the giant NHS data platform, and then the children's NHS number gets expanded into the education and welfare world, then Palantir system becomes the hub for everything the state knows about children. So that's how surveillance infrastructure is built, not in just one shock and law. It's linking existing pieces together. And if you've been following me for a while, you'll see bit by bit where we've been connecting these dots. And as always, I keep it factually based to provide you with clarity for you to be able to make up your own mind. This is what's happening, and this is a big shift. So the questions I've got is, well, why isn't it on mainstream media? Why are they not talking about this? You see, today parents are able to choose school versus home educating. Children have privacy by default. State intervention requires a cause, and there are things in place which enable that to happen already. But now we're moving into state monitors all children. So the default relationship there flips. So every child has become invisible, trackable, and categorized. So this is not about whether they need help or not. This is not about bad parents. This is about a data system woven into childhood. And once that system exists, there's no going back. The bill isn't law yet. So it's still waiting for the next stage in the House of Lords. So the window to act is right now. And this is a shift. It's happening behind the scenes with a lot of things, this digitalisation. And because it's happening in fragments and it's not getting spoken about and there's no clarity on it, people aren't knowing what to do, where to look. Where is this information coming from, if not from independent sources who you're able to find and follow? So I'll be linking the Good Law Project campaign to sign. Share this video. You know, fund our frontline safeguarding properly. Instead of building giant databases, put money into more social workers, smaller caseloads, earlier human intervention. The risk to children usually comes from lack of support, not lack of data. Target where the actual root cause is. Keep parental consent required unless there's evidence of significant harm. Focus on the children at risk. Don't track every child. Use optional support services. If more funding was to go into educational psychologists, counselling, support should be invented, not imposed. Protect the privacy of the NHS number. If services need better communications, use temporary case IDs. Do not permanently link health and education and family records. Medical identity must not become a state tracking number. Improve the communication between existing agencies. Schools, GPs and councils can already share information when necessary. Make the system that they already have more efficient, better trained, quicker escalation concerns. You don't need a new database to fix the basics, and respect home educating as a legitimate choice. Now, there's no funding for home educating. Provide resources, create collaboration between local authorities and home educated families, offer educational support without monitoring the home. Home education is not neglect, and it mustn't be treated as that. So limit access to child data with oversight. Data should be minimal. It should be minimal, strictly access controlled, logged and reviewable, parent viewable, and with a right to correct or delete errors. Privacy is a safeguard, not a obstacle. We don't need to track every child. We need support. We need to support the ones that need help without judgment. We don't need a new surveillance system. And that is the way it's going. We need more humans, not databases. And without going too deep into it, we are really within this shift here and crossing over into a realm of, if you have AI and these algorithms then where's the safeguarding when it can override itself? You know, the bill doesn't make children safer. It doesn't fix social care underfunding. It doesn't fix staffing issues. It just changes the power over children from parents to state. I do hope this provides you with a lot more clarity and more knowledge around it. As I say, I've linked the campaign in regards to the Good Law Project, and I will continue to keep you updated.